Hello, this is Dr. Grande. In today's video, I'll be covering 9 myths of borderline personality disorder. If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss any new videos. So let's get started with myth number 1. The first myth we see here is that all presentations of borderline personality disorder look the same. So what this myth is really saying is that if we see one presentation of borderline personality disorder, we've seen them all. Now, there are a number of reasons why this myth is not true. First of all, each individual is unique, so each presentation is going to be unique. But also, if we look at the symptom criteria for borderline personality disorder, we see that for a diagnosis of this disorder, an individual has to have at least 5 of 9 symptom criteria. Now, if we do the math here in terms of combinations, we see that there are 256 possible combinations. Because it's not just the 5 out of 9 in terms of the combinations, it's also 6 out of 9, 7 out of 9, 8 out of 9, and of course somebody could have all 9 symptom criteria. So if you add up all those combinations, that's 256 combinations without counting differences in severity, duration, and frequency, and of course without counting possible comorbid mental disorders and other factors. Another important point to make with this myth is that if you look at the symptom criteria, you can see that 2 individuals could have borderline personality disorder and only share one symptom. So there's a number of reasons why myth number 1 is not true. Myth number 2 is that a diagnosis of borderline personality disorder can only be provided to an individual who is 18 years or older. This is the case with antisocial personality disorder, but it is not the case with borderline personality disorder. Now, in the world of mental health treatment, we do see a hesitancy when it comes to assigning a diagnosis of borderline personality disorder when somebody's under 18. This isn't anything to do with the DSM, the Diagnostic and Statistical Manual, where borderline personality disorder is defined, but rather the stigma that's associated with the term borderline personality disorder. Certainly it's understandable to withhold a diagnosis if the diagnosis will cause harm, or if there's another ethical reason or a reason related to good practice why somebody would not diagnose. But a lot of times we look at, of course, a diagnosis as informing treatment. So it's important to get the correct diagnosis and assign it so that treatment, the appropriate treatment, can begin. I realize this is a complex issue, but in terms of the myth, a person can be diagnosed if they're under 18. Myth number 3 is that borderline personality disorder only affects females. Now, there are more diagnoses of borderline personality disorder given to females as compared to males. About 75% of the diagnosed presentations of borderline personality disorder are with females. But recent literature shows us that borderline personality disorder may affect females and males at the same rate. So there may be no gender difference at all when it comes to borderline personality disorder. Certainly, the myth that it only affects females is not true. Myth number 4 is that borderline personality disorder is easy to diagnose. And in a way, this connects back with myth number 1, that all presentations of borderline personality disorder look the same. So we know from that myth that there are 256 possible combinations when we look at the symptom criteria, but also it's hard to diagnose for a number of reasons. This is a myth that it's easy to diagnose. One reason is that, of course, each presentation looks different. Another reason is we see high comorbidity with borderline personality disorder. We see comorbidity in the area of depression, anxiety, substances. So there's a lot of complicating symptoms that make it difficult to diagnose borderline personality disorder. As with diagnosing any mental disorder, appropriate assessment takes time and clinical skill and should be approached with caution. Myth number 5 is that borderline personality disorder is rare. And I can understand why this myth persists. It's not unusual for a lot of different mental disorders to be thought of as rare. But actually, borderline personality disorder is fairly common. We don't know the exact prevalence, but research indicates that it's somewhere under 2% all the way up to almost 6%. And it affects about 10% of individuals in outpatient mental health care and about 20% of individuals in inpatient mental health care. Myth number 6 is that borderline personality disorder is always caused by trauma. We don't know if trauma causes any of the presentations of borderline personality disorder, although it does seem fairly clear that there's some connection there. Certainly it's a risk factor, and it may be a causal factor, what we call an etiological factor, but we just don't know. Even if we want to assume it is an etiological factor, we know that about 10 to 20% of individuals diagnosed with borderline personality disorder don't have any trauma history at all. So this idea that all borderline personality disorder is caused by trauma, this is a myth. Myth number 7 is that an individual with borderline personality disorder is dangerous. This is simply not the case. There's a slight increased risk of violence with borderline personality disorder and other personality disorders, but it's quite small. Sometimes it's made much worse by mixing substances in with the personality disorder. But even then, this isn't really a remarkable risk. When thinking about borderline personality disorder and violence, what would come to mind first would be self-harm or suicidal behavior. So borderline personality disorder is a dangerous disorder, but usually not to other people. It's more of a risk to the individual who has the disorder. Myth number 8 is that borderline personality disorder, in order to be treated effectively, must be treated by dialectical behavior therapy, or DBT. This simply isn't the case. We know that DBT appears to be as effective as other treatment modalities when it comes to borderline personality disorder, but it's also impractical sometimes because it's thought of as a program-only type of treatment in most cases. It can also be quite expensive. So the problem with this myth is that it allows somebody to see DBT as the only potential effective treatment, and therefore they would overlook other treatments which have been shown to be equally as effective. So DBT is an important treatment, but it's not the only treatment. I also have another video that covers dialectical behavior therapy if you're interested in that topic. So myth number 9 is that borderline personality disorder can't be treated at all. And we know this isn't true. We know that a number of modalities can be effective in many cases we see with borderline personality disorder. Now, there are a lot of variables that go into how effective any particular treatment will be with a specific individual, including level of insight, motivation, how much family support is available, the duration, frequency, and severity of the symptoms, comorbid mental disorders. So there are a lot of factors, and I think we also need to define success in treatment realistically. So if an individual had 5 or 6 of the 9 symptom criteria at one point, and then after 6 months of treatment or a year of treatment, they had 1 or 2 symptoms, I would generally look at that as successful because they no longer meet the criteria to be diagnosed with borderline personality disorder. So technically that would represent a remission, but there would still be symptoms present. So we have to look at success realistically. A lot of times, of course, when we think of personality disorders, we think of them as chronic and long-lasting. They're maladaptive patterns, and they involve extremes of personality traits. So we have to be realistic in terms of how much those traits are going to change and how much of a reduction we're going to see in severity, duration, and frequency. We know that treatment for borderline personality disorder generally does seem to be somewhat effective, but we also have to be realistic in terms of what type of goals we set and what we define as success. If the standard for success is all of the symptoms of these extreme personality traits are gone, I would say that would rarely be met. But if a goal for success is to no longer meet the full criteria for borderline personality disorder, that would be achievable in many cases. So borderline personality disorder is treatable, and I think the problem with this myth is it prevents people from seeking treatment because they get discouraged. I hope you found this description of 9 myths of borderline personality disorder to be interesting. Thanks for watching.